Have you ever wondered what you'd do if a heart attack struck and you were completely alone? It's a terrifying scenario, but it happens more often than we think. Many assume they'll have time or that someone nearby will help. The reality? The first few minutes are absolutely critical. What you do or don't do during those moments can be the difference between life and death. The good news is, even if you live alone or spend most of your time by yourself, you can survive a heart attack if you act quickly and know the right steps. In this video, we'll walk you through 7 essential actions you must take the moment a heart attack begins, especially when there's no one else around. These steps are simple, practical, and potentially life-saving. You don't need medical training. You don't need fancy tools. You just need a calm mind and some preparation. We'll explain how to recognize early symptoms, what you should take immediately, how to reduce strain on your heart, and even small actions that could buy you the time you need to get help. Be sure to stick with us to the end, because the final few tips are often forgotten, yet they could be the ones that actually save your life. Let's begin. Step 1. Know the early warning signs. The first and most crucial step in surviving a heart attack is recognizing its early symptoms. And it's not always a dramatic, crushing chest pain like in the movies. Real heart attacks often start with subtle signs, and these whispers from your body are easy to dismiss. Watch out for a deep, uncomfortable pressure or squeezing sensation in the center of your chest. It may feel like something is sitting on you or like cement is slowly filling your chest. The feeling may come and go, tricking you into thinking it's not serious. But if it lasts more than a few minutes or returns repeatedly, take it seriously. Other signs include shortness of breath, even when sitting still. You might feel like you've just climbed stairs without moving. Pain can also radiate to the arm, shoulder, neck, or jaw. Some experience dizziness, nausea, cold sweats, or unusual fatigue. In older adults or women, the pain might feel more like pressure in the stomach or back than the chest. Take Richard, 74. While sitting at his kitchen table, he noticed tightness under his collarbone, almost like heartburn. But he also couldn't take a full breath and began sweating. He remembered that not all heart attacks start with pain and decided to act. That decision may have saved his life. Your body often whispers before it screams. When something feels off, especially if it's paired with pressure, breathlessness, or fatigue, don't ignore it. Don't assume it's just indigestion. Stop what you're doing and act. Recognizing the signs early gives you your best chance at survival. Step 2. Call emergency services right away. If you suspect a heart attack, don't hesitate. Call 911 immediately. Don't wait to see if symptoms pass. Don't drive yourself. Don't downplay what's happening. Dialing emergency services is the fastest and most effective action you can take. Every minute your heart is deprived of oxygen. Damage increases. Paramedics are trained, equipped, and ready to keep you alive, even if your heart stops before reaching the hospital. Driving yourself is dangerous. You could lose consciousness behind the wheel, putting yourself and others at risk. Remember Linda, 78. She felt an ache in her shoulder followed by nausea and a cold sweat. Her instinct was to call her son, but then she remembered what a nurse once told her. Call 911 first, talk to your family later. She made the call. By the time the ambulance arrived, her symptoms had intensified, but she received immediate care. That phone call saved her life. Don't wait to be sure it's a heart attack. The dispatcher won't mind if it's a false alarm. They'd rather be safe than miss a critical moment. Keep your phone within easy reach, especially if you live alone. If you can't speak, use your phone's emergency call feature, even from a locked screen. Step 3. Chew an aspirin, calmly and slowly. After calling for help, your next step is surprisingly simple. Chew an aspirin. Not swallow. Chew. Do it slowly, even if your hands are trembling. If you have a standard 325 milligrams aspirin and you're not allergic or on certain blood thinners, this one act can significantly improve your chance of survival. Aspirin thins the blood, helping to slow or stop the growth of a clot that's blocking blood flow to your heart. Chewing it gets it into your system faster than swallowing. If you can, avoid taking it on an empty stomach. But during a heart attack, the risk of blood clots outweighs the risk of stomach irritation. Don't worry if it's not a fast-release tablet. Chew whatever kind you have. Joe, 72, felt tightness in his chest one morning. He remembered the aspirin in his kitchen, chewed one, and sat down while waiting for help. Later, his doctor said that single action likely reduced the damage to his heart. Make aspirin easy to access. Keep it in your nightstand, kitchen drawer, wallet, or purse, and let loved ones know where it is. Check that it's not expired. This small step, backed by emergency responders worldwide, could be the one that keeps your heart from worsening. Step 4. Sit or lie down to protect your heart. Once you've called for help and taken aspirin, stop moving. Sit or lie down in the safest, most comfortable position possible. Now isn't the time to walk around, collect belongings, or even unlock doors, unless absolutely necessary. Every bit of movement places more strain on your already overworked heart. Ideally, sit upright with your back supported, feet flat, and arms relaxed. If you feel faint or lightheaded, lie on your side with your head slightly raised. Avoid the instinct to tough it out or stay busy. That mindset, while admirable in other parts of life, is dangerous here. Doing nothing is, in fact, doing something. It allows your body to stabilize and conserve energy. Alice, 81, felt chest pressure while cleaning. Her instinct was to tidy up before calling her daughter, but then she remembered her doctor's advice. If it's your heart, sit down. Everything else can wait. She sat in her recliner. That stillness may have prevented cardiac arrest. Support your back. Don't slump. Breathe slowly. The more relaxed you are, the less your heart must work to keep you alive. Step 5. Unlock your door for first responders. If you can do so without straining yourself, unlock your door. It sounds small, but it can save crucial minutes and prevent emergency personnel from having to break in. Paramedics are trained to force entry, but that takes time, causes damage, and could even harm you if you're near the door. If your front door is unlocked, they can get to you instantly. Paul, 76, lives in a condo. When symptoms began, he called 911, chewed aspirin, and unlocked his door, all in 2 minutes. The paramedics said it saved them 30 seconds, enough time to make a big difference. If reaching the door feels unsafe, don't do it. But if it's close and you're steady enough, unlock it. Consider smart locks, key boxes, or giving a neighbor access. Plan ahead, because in an emergency, even a few seconds matter. Step 6. Use speakerphone and set up medical ID. Your phone isn't just a tool, it's a lifeline. Use speakerphone to stay connected without holding the phone to your ear, especially when your body's under stress. It keeps your breathing easier, your hands free, and lets dispatchers hear you more clearly. They can also listen for breathing changes or movement sounds if you suddenly stop talking. Even more powerful is your phone's medical ID. On iPhones, it's accessible from the lock screen. Most Android phones have a similar feature. It contains critical info like your medical history, allergies, and emergency contacts. Susan, 79, passed out just before help arrived, but her phone had her medical ID set up. The paramedics saw she was diabetic and allergic to penicillin. Information that helped guide her treatment and avoid a dangerous mistake. Setting up your medical ID takes 5 minutes. Include your name, birth date, major health conditions, medications, allergies, and emergency contacts. It's not just for tech-savvy folks. It's for anyone who may one day need help while unable to speak. So use speakerphone to stay connected. Trust the calm voice on the line, and let your phone speak for you if you can't. Step 7. Slow your breathing to steady your heart. In the midst of a heart attack, panic can take over. Your chest feels tight. Thoughts race. Every second is louder than the last. But you still have a powerful tool: your breath. You can't stop the heart attack, but slowing your breath can calm your nervous system, reduce anxiety, and prevent your heart from spiraling into dangerous rhythms caused by stress. You don't need fancy techniques. Just try this. Breathe in slowly through your nose for 4 seconds. Hold briefly. Breathe out through your mouth for 6 seconds. Repeat. Focus on this rhythm. It gives your body something to anchor to. Frank, 83, felt like fear was drowning him when chest pain struck, but he remembered the breathing exercise his doctor once taught him. He stayed still, focused on each breath, and calmed his mind. His heart was still unstable, but hadn't gone into arrest by the time paramedics arrived. Your breath won't fix your arteries, but it can buy you time, keep oxygen flowing, and give your heart the edge it needs to hold on. Final thoughts. Surviving a heart attack alone isn't just about luck. It's about preparation, awareness, and calm action. These 7 steps, simple on their own, form a powerful survival chain when used together. Recognize warning signs. Call for help immediately. Chew an aspirin. Sit or lie down. Unlock the door, use your phone wisely, breathe to stay calm. Each step gives you back a little control. Each step says, even when you're alone, you are not helpless. So what stood out most to you? Was there a tip you hadn't thought of before? One you'll apply now? Share it in the comments. We'd love to hear what you learned. It might help someone else too. If you found this video helpful, like, subscribe, and share it. Your support helps us keep making content that informs and inspires. Thank you for watching. Stay safe, and we'll see you in the next video.